right away, but what did she say? She was like, but maybe in the next few hours is what she said we can give whenever the epidural has worn off.
Yeah, they're coming out of there and they're anesthetized, and yeah, we're not gonna just jump up. We got every 15-minute vitals for one thing. So what are, within 2-3 hours, what are some of the reasons we wanna do that?
So they don't get blood clots.
It's a big reason, blood clots, big reason. Just think surgery, a C-section is a surgery. Why do you get post-surgical stuff right away?
Respiratory stuff,
Mhm.
pneumonia.
Good. What is the difference between that and a vaginal for assessments?
You still want to do bleeding and stuff.
But they have an incision you have to look at too.
The C-section has the incision. Make sure you're looking at that incision. C-section is more likely to have an IV. And keep the IV. Hey, come on in.
Thanks, girl. Mashed up for you. Hold on. Here. Help yourselves. Thank you.
Well, Kimberly said she'd bring pizza, and I was like, okay, I'll bring drinks.
Right.
Why not?
Thank you.
Thank you.
Of course.
Sorry to interrupt.
That's okay.
We're
Glad
talking
you made
about
it.
C-section versus vaginal after their birth.
Like
Assessments.
Okay.
What is one way, well, we're talking about right after delivery, that we're gonna help prevent mastitis?
Make sure the baby nurses or that she's expressed, you have to express it if you're not gonna nurse the baby, right? You just keep like compresses or something?
If a lot of people, it's kind of vogue right now to pump and feed.
Okay.
Is mastitis the clot, the milk clot?
Starts as a clogged milk duct,
Okay.
but it's an actual infection.
Oh,
You get fever and everything.
like in the actual duct, that's what it is?
It's in the breast tissue,
Okay.
so it's a good thing you're asking that, because you can still go ahead and breastfeed the baby. It's not in the milk,
Okay.
it's in the tissue of the breasts. So one thing we can do to help reduce that is get that baby to breast as soon as possible after delivery, okay? It's not only good for the bonding, good for the baby to get that colostrum right away, but also good to help with the mastitis right off the bat. And while she's breastfeeding, what are some things that might be happening to her?
Isn't like the oxy,
Contractions
Yeah.
is what I've been
Yeah.
saying.
Oxytocin, yep, she's gonna be contracted. So if I'm comparing someone who is having her first baby, someone that's having her third baby, someone that's having her sixth baby, who's gonna have these, what they call after pains, these contractions? Who's gonna hurt the worst for the contractions? This one. Your grand multips, 5 or more babies, their after pains are gonna be more severe. Now, you're gonna tell your prime milk that, she's gonna think you're nuts because she thinks that she's gonna die, okay? But your grand multips are gonna have more after pains. You are gonna want lots of therapeutic communication in this exam, lots. That's just a maternal newborn thing. A lot of the faculty up here were either labor and delivery or NICU nurses, because in this field, we just do so much teaching, it becomes natural then to kind of get into the teaching field, so. So a lot of therapeutic communication. And remember, some of those questions, when they come up, a surgery is a surgery. A hemorrhage is a hemorrhage. A DVT is a DVT. So don't overcomplicate it trying to make it too specific sometimes, okay? C-section is a surgery. So you're gonna wanna know about the thrombophlebitis, the DVTs, and the PEs. If we throw a pulmonary embolism, what's that patient gonna look like? You're gonna wanna know that. And you probably already know that from maybe even 310 a little bit.
You said thrombophlebitis, DVTs, and pulmonary embolism?
Thrombophlebitis.
Okay. Got it.
So you're gonna wanna know kind of what those are gonna look like, how we're gonna identify that, and how we're gonna help prevent that. And if they have it, for example, you remember with DVTs, if you're suspecting that she has a DVT, what kind of cares are you gonna give her? Well, first of all, we're not gonna massage her legs, right? because we don't want to dislodge that. We might elevate her legs, but don't put a big wedge under the knees. Kind of kinking it more doing that. ROGAM. What's ROGAM?
When the mom is like RH positive and the baby's negative, you give that to her, right?
Isn't it the baby's positive?
Oh, my bad, sorry.
So study that, remember that, because that is very easy to turn around. But you might want to know that very soon in your life. Okay?
So baby's positive, mom's
Yes.
negative.
Mom's negative. Her cells have never seen these spiky things. So here she comes along and sees these spiky things and she attacks them. So we give her this ROGAM, which is kind of like a vaccine almost, to tell her to stop it. If I've just delivered a baby and they're giving me ROGAM, is it for the baby I just had? It's for my next pregnancy. All right. Infections. Different kinds of infections. Where might we find infections in our postpartum moms?
C-section. Oh yeah, that too.
I didn't, what?
UTIs.
UTIs, huge problem. And what did you say? Oh,
Like in the
C-section.
incision.
Incisions. And don't forget, even though we don't cut the incisions anymore, the episiotomies, a lot of them will have a tear down there that we gotta watch for infection. So she is 12 hours post-delivery and her white blood count is 20,000. Sign of infection?
That one, no.
Probably not.
They have high white blood cells.
2 days later, yeah, let's look at that a little more closely. All right. If I'm worried about infections, say cervical, vaginal, uterine, before or after delivery, what are some things I'm gonna inspect there or assess?
Like tenderness, pain.
Might have some tenderness, uterine tenderness, especially after. Temperatures, white blood counts, the odor of the vaginal discharge. I'm sorry, I know you're eating, but we're nurses, right?
I think we should be past that by now.
Right? The odor. And it's hard to describe it. When you smell it, you know that. It can be an indication of infection. Remember that your temps right after delivery might be a little elevated. Doesn't mean infection. Same with your white blood count, so you can see how it might be kind of tricky right after delivery to catch those infections. So you kind of want to know those numbers. Speaking of numbers, you'll want to know, it's in my notes somewhere, like the weight gain, like you're obese, how much they should weigh or gain. You're super thin, how much they should gain. And while you're on that topic, think about the exercise and the nutrition. Can pregnant women exercise?
Yeah.
Okay. Can they do any kind of exercise they want?
No.
If you have a marathon runner, she can keep running. Okay, as long as she's comfortable, she can keep running. But if she's a football player, maybe not. Let's maybe not play football. She can do a little weightlifting, but of course as she gets bigger, we need to back that off. Okay. Walking is excellent. Nutrition, what is that? What is that we're going to take to prevent neural tube defects?
Folic acid.
Folic acid. When she becomes pregnant, she's going to double her iron intake. So think, you've had so much nutrition in your classes, so think about where those, other than taking a pill, where she's going to get those things. Because it's usually better to get that from food than from a pill, right, if we can. Remember, dark leaf, greeny veg, just think about your nutrition needs. Okay, I got sidetracked, sorry, I'll go back up to where I was. Depression. Who is at risk for depression? Signs of, not just the postpartum depression, okay? Not the baby blues, but the actual postpartum depression. At what point do we say, okay, we've gone from the blues to postpartum depression? And who is at risk for that? Can we identify?
Is it postpartum's like 2 weeks or whatever, like after you've had the baby, and they're like, what am I trying to say?
Like more than 2 weeks and they're still depressed.
But it's like they're like feeling like a disconnect from their family.
Right, it's like Postpartum blues is a thing, it's the blues, okay, your hormones are going crazy for a few weeks here. But yeah, when we get that far out postpartum and we're still feeling despondent, we're still crying all the time, we have no interest in anything, now we probably need to get some other people on board, like some social help and stuff, okay? People that have had depression before are at higher risk for having postpartum depression. And then think about, your teenagers that maybe don't have any support, or your single moms who have to go right back to work, things that place them at higher. Vaccines. What vaccines are we giving or not giving during pregnancy?
Not the MMR during pregnancy. You can't give the MMR during pregnancy, but right after.
What is it specifically in the MMR? Do you remember? Rubella. So we often give MMR after delivery. We do a titer. If her titer is too low, we often give the MMR. Because at that moment, I know she is not pregnant, okay? And then educate her to not become pregnant, right? For a little while. What are some of the vaccines they do give a lot during pregnancy? When you look at your your paperwork.
Tetanus.
You give tetanus a lot. Tdap, pertussis.
Yeah.
It's the pertussis we're after. And we everyone in the household should get the pertussis. What else?
Flu.
If it's flu season, absolutely, which in 9 months, at some point, it's gonna be flu season. They're giving COVID vaccines now. I don't think that's gonna be on your NCLEX, it's a little soon for that, but that MMR is gonna have to wait. I know I'm jumping all over the place, but you guys are being patient. Mastitis we talked about, signs and symptoms of mastitis, how to prevent it, the risks of it, vaccines, depression, infection, after pains. How would I know? There are some physical differences for a woman who has never had a baby before compared to a woman who has had a pregnancy before. I don't know a great way to ask you that, but if I have a woman coming into my clinic and I'm doing an assessment on her, what are some indications I might find that would tell me that she's had a pregnancy before?
The first cervix is like already dilated a little bit.
So right now, if you've never had a baby,
No, but if you have.
Right, if you've never had a baby, that cervix is tight. If you've had a baby, even if it's not dilated, there is a little, like a slit. It's never gonna be that tight again, all right? So that's a pretty good indication. Question, oh, I don't wanna breastfeed because it'll make my boobs saggy. Thoughts on that? Does the breastfeeding make them saggy? What is it that makes them saggy, other than age?
Not wearing a bra.
Not wearing a bra. It's the hormones.
Sorry, y'all.
The hormones are what make them saggy. So whether they breastfeed or not, they've already got those hormones. So having a baby is already gonna make you saggy. Tell me the stages of rubra. No, lochia. Okay, I gave you the first
one's
stage.
rubra.
First one's rubra, lochia, and then
Rusty? West Keller, what's the name of that?
Serosa.
something in
Well, that's
between.
the last one.
Serosa sanguinis, but
Yeah.
yeah, serosa, okay. The last one is, who speaks Spanish? Alba,
Oh,
I always forget that one. That's the only one I always forget.
and that's the order it should go in, right? So if you're discharging,
Serosa alba.
yep, it keeps getting lighter. Cause that, at the end, that's just a bunch of like decidua and stuff, okay? Doesn't mean it's infection, it's pretty normal. If they get home, some of your teaching, you go home, you're gonna probably have heavier flow, cause you're getting up, you're doing more. If her lochia, she's not gonna know what that word is, so what are you gonna say? If you're bleeding, your vaginal bleeding is red, it'll get lighter, it'll eventually be white. If it goes, it's white, and then it gets red again, that's something she should probably report, right? It should not go backwards. Now, she may bleed heavier when she gets home, but the color shouldn't go backwards.
So when you're checking a woman and she's got like, it's dark though, that's all rubra?
Because it's getting lighter. Fundus. Tell me about that fundus during pregnancy. Remember to use posters. Do you guys ever have them? I don't, but I got it.
Use the coaster baby. Oh, okay, thank you.
I have a peanut butter power. Are you kidding me? I bet $6 on it. I'm drinking it.
Well, it looks a little low if you want one.
It does look a little. What was I talking about?
Fundus.
Tell me about the fundus during pregnancy. Isn't that what I asked?
Yes. Oh, like where the heights are?
Yeah. Tell me about that.
Can't you, I think you could start feeling it at, right? I want to say 14. See, I was gonna say 12. But is 12 too early? At 12 weeks?
I have my book. Do you guys have yours?
The 12 weeks gestation, the fundus is palpable at the
Yeah.
symphysis.
Good job.
Yeah.
What about 20 weeks?
20, it reaches the belly button.
Okay.
Umbilicus.
Umbilicus.
Yeah.
Umbilic. It depends on what part of the country you're from.
That
Um,
one.
Where might it be at, say, 22 weeks?
Right, 2 fingers below. Right below.
Above.
Oh, above.
If it's at 20 weeks, if it's at the umbilicus, it's going to keep going up.
Oh, yeah. Okay.
Yep.
Right. That.
When does it stop going up?
40.
36.
36.
Nice. Stops going up.
And then remember when the baby drops, what's that called? When the baby
Lightning.
when there's lightning, the fundus is going to start to come back down again. Okay. So if that's lightning, what's quickening?
When you first feel the baby move.
Little flutters and stuff. Okay. Don't get those two confused. Both have to do with light or speed or something. Okay, so what if a woman comes in and she is 20 weeks and I am feeling that fundus halfway up to the xiphoid, from the belly button to the xiphoid?
So it's too big.
Okay, what might be some reasons it's too big?
Hydramnios.
Yeah. Extra.
Does
You
say
said
it-
hydramnios.
That means not enough, right?
Hydramnios is just the amniotic fluid.
Oh, polyamnios.
Polyhydramnios.
Polyhydramnios.
Got
So
it.
polyhydramnios is too much fluid.
You write that down.
Oligohydramnios,
Less.
not enough. Okay?
Wait, that's a lot of letters. Polyandriamnio.
Polyhydramnios.
Got it.
He'll hydra.
Well, you guys know poly and oligo, so you should be able to figure that out then when you see that. If it's not polyhydramnios, what else might it be?
Twins?
Might be twins. Hopefully we've caught it before 20 weeks.
A big baby.
What if it's just like her, she just got like pregnant sooner than she thought, whatever, like
Her dates might be wrong,
Yeah.
which again, hopefully we caught before 20 weeks. But yes, these are some reasons that it would be. What was I gonna say about that? It's gone. After pains. Okay, now tell me about the fundus after delivery.
it needs to be firm.
Okay,
If
what
it's
else?
boggy, you have to massage it. Massage.
Massage. That's your first intervention,
If it's to the left or right, they need to go to the bathroom.
probably, especially if it's elevated into the side. So why do I have to get her up and go to the bathroom? So what? She doesn't feel like she has to pee. So why do I make her?
So that the bladder shrinks back so that the fundus can go back.
Okay. And
Oh,
then,
isn't it like infection or something, or like it can explode or
oh my God.
something can happen to the uterus, right? Where it starts to bleed or.
You're on the right track. I think if I gave you enough time, you'd come up with it. If that bladder is full, it's holding that uterus up, the uterus can't contract, it can't be firm, and what happens if I have a non-firm postpartum uterus?
Starts to bleed.
Hemorrhaging. Yep. Just like during labor, that bladder is in the way. Empty the bladder and then massage that. So I walk into a patient's room and she hasn't been up for about 4 hours and I need to do her assessment. Just be nice and ask her to get up to the bathroom before you pound on her. stomach, okay? So, right after delivery, where am I gonna find the fundus?
Just under the belly button.
It's gonna be a little bit below the belly button, maybe even quite a bit below the belly button, right after delivery. Now I come in tomorrow and I assess it, where am I gonna find it?
Couple
Next
centimeters.
to, like finger things.
Could be two above, It could be two above, it could. I'm gonna watch that very closely if it is. If I'm on day 3 and I'm two above, we got a problem. But that very first 24 hours, it could sneak up above the belly button. But otherwise, every day of postpartum, it should be 1 finger below the umbilicus. Okay, because that's approximately a centimeter.
So right after birth, it's expected to be above it.
No, right after birth, it's gonna be lower, because everything just came out.
You're right.
And then we're gonna do some of that healing and swelling, and it's gonna come back up a bit, and it's gonna slowly go back down. You probably wanna look up and know at what point we should no longer be able to feel that fundus. Okay, because I'm not gonna feel my fundus the rest of my life, am I? What is, okay, you're gonna wanna know some of these physical changes of pregnancy. For example, stretch marks, there's another name for stretch marks, what is it?
Striatum.
Gravidarum.
Gravidarum.
Yep, okay. Are they forever gonna look like that? Bright red tears in your abdomen forever?
They're gonna turn like silvery.
They will eventually kind of be more of a silver. They're yours, you own them now, but they will fade. Linea nigra,
The line, like on the belly, right? Yeah, the dark line.
yep, runs right up the middle of the belly.
What
Okay.
did you say that was?
Linea nigra, black line. Cloasma. Come on, cloasma, CHLOASMA. You guys yelled at me about this.
I'm sorry, I didn't yell. It's just spots on their face.
The pregnancy mask, yeah. Cloasma,
Doesn't the book say patches or something?
maybe.
No? Okay.
Cloasma. Talk about weight gain, exercise, nutrition, quickening. When should we feel quickening? Did you tell me?
It's like halfway through, isn't it?
Well, you gotta be a little more.
20 weeks.
I think it's before that even.
Okay.
18.
Your multip might feel it at 14,
16.
about 16. We talked about poly and oligo. What is placenta previa?
Placenta detaches a little bit.
That's the abruptio.
That's what my patient had today.
Abruptio? Well, tell us about
She
it.
had an abruption last night. So then she like had her baby at like 2 o'clock this morning. That's the baby I was holding all morning.
Oh, because mom wasn't feeling good.
Yeah. And then they like, cause I was in like postpartum today, so then they like gave her they started her on MAG,
Okay.
but they started her like really late. Like my nurse was saying that she should have been started way earlier, cause she wasn't started until close to like 9 o'clock this morning.
Okay.
So then a labor and delivery nurse took her over and I just had the baby. So that's all I know.
Because if they're on MAG, yeah, they're probably gonna stay with a labor nurse, because postpartum, we don't see as much of the MAG. What was the big concern? I assume they did an emergency C-section, do you know?
That I would assume so. I don't know. I didn't really.
Why does that become an emergency? A placenta abruptio,
Because of all the bleeding.
from both mom and baby. They're
Actually,
both
she did
bleeding.
because they were talking about how big the blood clots were.
They both bleed out fast. Very, very vascular, that placenta is, and that uterus. So then what's the previa?
It's not attached where it's supposed to be, below. In
It's,
the opening of the,
there's different stages, they can be completely covering it, it could be almost touching it. So think about that, the two different terms to keep them straight. Placenta abruptio is just, we have an abruption, and there is both of them are bleeding, okay? The previa, the placenta is coming previously to the baby, okay? Can I deliver through that? So if I have a placenta previa, now, if it's not completely over the os, as the uterus grows, it can pull it up away. Great, fantastic, everybody's happy. If it doesn't, I can't deliver through that. That's an automatic C-section, right? Signs and symptoms. How will I know if I see vaginal bleeding? How will I differentiate a previa from an abruptio as a nurse? You walk in, you got vaginal bleeding, I'm gonna ask you some questions to help me determine.
The amount, maybe?
Nope,
Spontaneous start and stop.
what?
Spontaneous bleeding, like starting or stopping.
No, not so much. Think about pain.
Bleeding without pain,
Is,
bleeding without pain or little pain,
which one?
previa. Sorry.
Okay.
I
So
thought we
if,
were still on previa, that's fine.
if they're coming in and they're having bleeding, but they're like, but I'm not having any contractions, I'm not having any pain, nothing's going on, more likely it's previa. Okay, if they come in and their abdomen is hard as a board, that's probably an abruption. Why is it hard like a board?
Bleeding.
We probably got blood in the peritoneum. Remember, sometimes with these abruptios, you're not gonna see bleeding because it's gonna be encapsulated up where it's not getting to the cervix. And so you're just bleeding out up here, but it's not able to drain out the cervix. So if they come in with a board-like abdomen, even though you don't see blood, be worried about that.
You said most times they're not bleeding? Or is it just sometimes?
I don't know that I said most, but sometimes they're not bleeding. But they're having pain. Ectopic pregnancy, what is that?
It's when it's not in the, it's like outside of it.
Outside of the uterus. It has attached somewhere it shouldn't. It's ectopic. So what do I care about that? Oh, it is about two. Yeah,
Thanks for letting us know.
of course. Just getting you psyched up for school, that's all.
Are you gonna be going here?
Maybe.
I hope so. It's a good school.
All right, ectopic, why do I care that it's outside the uterus?
And kill the mama.
Mm-hmm.
I mean, baby won't live either.
Baby's not gonna live. The uterus is the only thing that can support that developing. So it's gonna rupture and mom's gonna bleed to death. Lots of hemorrhaging can happen during pregnancy and postpartum. So ectopic, it's not where it's supposed to. What puts her at risk for having an ectopic?
Age?
I'm sorry, what?
Oh, advanced maternal age.
Okay, taste of paint. I was like,
Eating paint, you have other problems.
right, that could be. What else? IUDs,
I was just gonna say, doesn't it have something to do with like scarring or tissue?
scarring, lots of STDs, history of STDs, or STIs we call them now.
So then would that be like a previous abortion or something could also cause it?
Mhm. If they've had a previous ectopic,
Mhm.
they're at higher risk, yeah. STIs are pretty big though. They cause a lot of scarring. Some of them you don't even know you have, like, what's the CH one? Chlamydia. Chlamydia is often asymptomatic. So,
Could a C-section be part of scarring?
Mhm.
So-
less so, but yeah. Okay, so signs and symptoms of the ectopic. Someone walks into my clinic and they are complaining of
Sharp pain,
where?
abdomen, or
Usually on one side or the other,
Yeah.
but yeah, where else?
Back?
Not so much. Shoulder. If they're having a lot of shoulder pain, it's referred pain.
How does that happen?
Because there's bleeding in the peritoneum, or some kind of growth happening in the peritoneum, and it's just, it's like, the nerves are just, it's just a referred pain. That's just where you're gonna hurt in the shoulder. Okay. You want to know the difference between, this is definitely a sign of pregnancy and this is a probable sign of pregnancy. Like if I'm at home and I take a home pregnancy test.
presumptive,
Huh?
presumptive,
Right, it's not definite. Okay, so what are the definites?
For a pregnancy test?
for pregnancy? When can I say yes, that is a definite positive?
The
After
exam,
hearing the fetal heart tones?
Yep, if you can hear the heart tones
Ultrasound?
the
on an
exam-
ultrasound, hear the heart tones on an ultrasound. When?
The exam by the physician. or
Usually, if the examiner can
Yeah,
feel the
yeah.
fetal movement, which isn't gonna happen until,
like 20 weeks,
well, at least,
or
well, yeah,
16
yeah.
weeks, yeah, 16
Okay.
weeks.
So you wanna know that. Yeah, you took a home pregnancy test. It's not a definitive, believe it or not.
Wasn't there 3?
There's a third one, okay, let me back up. Fetal movement, fetal heart, and what was it? Does anyone know?
Well, I thought there was like 3 ways of
Good
like
O's?
getting pregnant.
The good O's?
sign, the cervix,
I'm tripping.
the soft, no, is it? Yeah.
Chadwick's.
Chadwick.
Did you say there's 3 different ways of getting pregnant?
No, telling that you're pregnant. There was like presumptive and then
Yes,
something and then
probable.
yeah.
Yeah. You're right.
Okay.
Really, I really want you to know what is the definite.
Okay.
That's the hearing the fetal heart tones.
Yeah, that's
on
those where-
ultrasound.
This is now absolutely positive. Because if you know what those are, then you know everything else is maybe probable, maybe presumptive, but we gotta have these. Expected changes for the woman in pregnancy. What's gonna happen to her breasts?
Get bigger.
They're gonna get bigger. What else?
Tender.
Gonna get, tenderness. The areola and the nipple are gonna get dark. Okay? Think of it as creating a bullseye for the baby, for nursing. So that's gonna get darker. What else is gonna be happening to mom?
Nausea.
For a lot of them, not a lot of them, not all of them. Okay, especially your primates. We already talked about chloasma and linea nigra, right? We already talked about that. Anything else we can think of?
Exhaustion.
Mm-hmm. Maybe heightened sexual arousal. I think I said I was only gonna ask you about GP, but in all the review questions I've been doing for the NCLEX, it does ask you about GT-PAL. So I did put something in there about GT-PAL. So what does that mean?
How many times you've been pregnant,
Gravid pregnancies,
how many babies you've had to term,
okay?
how many have been preterm, so
Uh-huh.
less than 37 weeks, how many abortions or miscarriages.
Mhm.
So that's anything below, or no, 20, yeah.
Okay.
And then how many living children you have.
So be careful when you're counting like the preterm and the term. You're talking pregnancies, not babies. So if you're carrying 6 babies, it's only 1 G and P. Okay? Or T or whatever it ends up
That's
being.
my problem.
One.
You just fixed a lot for me, cause I'm
So
like,
the
but
only
how
one
many
that's
can you
you're
get?
counting is like the living children one, otherwise it's just like,
Mhm.
so if you have triplets, it's just 1 abortion.
Until you get to the living. Yep. Confusing.
Yes, it finally made sense right
Yep.
now when you said that.
Confusing. It's the pregnancy.
So the term is 40, the preemie is below 27. Right? Is that what you said?
No, the
Um,
term is 38.
So
Okay.
anything less than 37 is your P.
And then what did you say about the abortion? You said less than
20.
Okay.
But this one's like, it's like 36 in 6 days. So then once you get to 37, you're at your term. Does that make sense?
Yeah, it's called late or early term or late preterm. So there's a gray hair area here in the 37th week.
Does that make sense?
So you said when you get to 37, then
Yeah.
your term,
Yes.
Okay.
So then, but if you're 36 and 6,
you're a preterm.
you're preterm.
Days matter.
Well, they said my daughter
Yeah,
was
that's what I wanted to do.
preterm, or preemie for 37 and 2 days.
So that she was a late preterm.
Okay.
My first child was a late preterm. So that's that gray area in that 37-week period.
Okay.
Yeah. Because full term is 38 to 42. Tell me about drugs, class B and C drugs.
Good question.
I think
Okay.
you have ibuprofen, right?
So ibuprofen is a C. Do not take ibuprofen. B are drugs that have not shown to cause damage to the baby. Like Tylenol.
C, don't take.
Do not take C. They have,
And
So-
B, you can't take.
yes. So B is gonna be like your Tylenol. You can take Tylenol during pregnancy. You cannot take naproxen, ibuprofen. Off the top of my head, I can't come up with other ones, but, oh, aspirin. You can't take aspirin, but you can take Tylenol.
Isn't that like the only thing you can take besides like your vitamins and stuff, pretty much?
Pretty much. I mean, you know, when you get into your antidepressants and stuff, this is when we have to balance benefit to harm. You know, if taking mom off of the antidepressants is gonna make her harm herself or even kill herself, well, that's not good for the baby, right? Because now they're both dead. So you gotta really start balancing.
Or like if they're extra, like really hypertensive, they'll probably still need to take their like hypertensive meds.
Absolutely, because we might go into a preeclamptic emergency. Good. Let's see, what is that called? I kept asking you the different levels of the fundus. After the baby is born and the fundus starts going down, what do we call that? There's a word for that.
Descending. I don't know.
Involution. Involution. Did I mention there's a lot on therapeutic communication?
Yes. Could you give me like an example?
Did you guys see that video several years old of I and my daughter having a talk about her being pregnant? It was just a little video. It's about therapeutic communication where she's sitting there and I'm pretending to be the NP or whatever. And I said, so how do you feel about that positive pregnancy test? And then I turn away from her and I start typing. And she's just like, my folks are gonna be pissed. And I say, oh, give them a little time. I'm sure they'll be excited to be grandparents. So a therapeutic communication question might be, what would be a proper response to her?
Okay. Or like, so like, why do you think this, or?
Tell me more.
Let's
Tell
talk
me-
about
yeah,
it or something.
Okay.
Mm-hmm.
Okay.
Yeah, or you sound nervous to tell your parents, you know, kind of rephrase it or whatever, those kinds of things.
I'm bad at that. I'm
Um,
terrible
I
at
get
that.
awkward.
Yeah, me too.
Yeah, I'm obviously not great, but something to work on. Let me look at my notes. Is there anything we're missing? What time is it? So we talked about infections, UTIs, uterine infections, mastitis infections. UTIs are pretty common. The temperature fluctuations that we're gonna watch, the odor, the white blood count, and when those should go back to normal, and then we know that we got another issue going on. Talked about the cervix change for the gravida 0 to gravida plus whatever. Talk about after pains. And that breastfeeding, we like it when breastfeeding makes them contract and they're like, oh, that hurts so bad. You breastfeeding lactation consultants, we like that. Because that tells me, oh, baby has a nice strong latch going, you're releasing a lot of oxy. Talked about stages of rubra. The rate of involution, I mentioned that, but how quickly do we expect that fundus to come down? Contraceptives. So you kind of want to review, like some contraceptives are pretty darn reliable, others not so much. So you might want to go through that. For example, what is probably other than abstinence? Of course, abstinence is the only 100%. But as far as contraceptives go, what is probably the most reliable?
Is it the IUD?
The IUD.
That's the worst one. I don't
That's
know
the
if
what?
it's- I don't know if it
Oh.
is, but
That's what I've been told. That's like what my doctors would tell me.
That it's the worst one?
Yeah,
For, like,
it's
the-
most
The
effective.
scarring or whatever.
Oh, yeah.
Yeah.
Yep. As far as people trying to not conceive, what is the least effective?
Calendar method?
Calendar or stroke method. So counting the days. Oh, I can't have sex during these days. Well, that's, for one thing, people are gonna get horny and do what people do, you know, outside those days.
And sometimes your ovaries can release on different days.
Yeah, and we can't depend on those day counting. Okay. Do condoms prevent spread of STDs? They really don't. Female condoms more so. Male condoms, not really, especially the natural ones. Because the pores, especially for like HIV, the pores of the natural condoms are just a little bigger than, so the HIV can go right through it. Seems like there's something about herpes.
Do you normally hear like condoms usually prevent, like they promote that condoms prevent STDs and like stuff
But
like
are we
that?
talking like all the time, or are you just saying in general? Like, they still do.
Your synthetic ones, not your natural ones, are better. There is a barrier, but the only thing that it is barriering is the skin of the penis and the skin of the vagina. Those are the only two areas that are being protected. STDs are in other areas. Any area down there that comes in contact with any area that down there, skin to skin down there, can transmit STDs.
Okay.
Plus, some of those little viruses can get through the condoms. Condoms break. Guys don't want to put the condoms on. So, what's the problem with pills? Why are pills not so good at contraception? I mean, they're good, but what could,
People forget to take them.
they aren't consistent with taking them, okay? Let's see. I think we covered just about everything there. I think we've covered all the topics I wanted to make sure we got over. Questions for me?
So that was over both halves of the test, like the beginning that we're being retested over, and then the stuff we've learned since then?
Yeah, I don't know that it's cut down the middle, but. Okay, other questions?
So I was like studying, I got through the first 4 chapters last night.
Okay.
I'm so confused, not so, but like the genes and stuff.
Mhm.
What teaching do you expect us to know for like
Genotypes?
to teach genotypes and stuff? Okay.
No, I'm saying, I was finishing your question, because I'm
Oh,
wondering, what do we
yeah.
teach them about genotypes?
Right, that's what I was just, because the whole chapter's a lot about just like recessive and dominant, and like I went through the X-linked traits and like girls and guys XX and XY. But then when it got to like the teaching, I don't really know what to teach people about that, like what they need to know.
So if, I've got some Jewish genetic history, and if I'm going to have a child with a Jewish person, part of the education maybe we should be tested for Tay-Sachs.
Okay.
There are some, parents also need to understand, and this is hard, if you have, based on the whole X thing, where you do the whole, you got a 25% chance of having this, okay? That's each pregnancy. If I have 4 kids, it doesn't mean only one of them's gonna have it. It means each pregnancy has 25% chance, okay? And a lot of parents, that gets confusing for them. Looking for, what's that one? I was just teaching it in class just the other day, where you gotta wear the vibrating chest, it's a respiratory thing.
Cystic fibrosis.
Thank you. You know, screening for that. Are you both a carrier for that? If so, you know, we've had a good chance of having a kid with that. Those kinds of things.
Okay, do you want us to know like the difference between like the recessive and the dominant, how like you have to have 2 recessive, but you only have to have 1 dominant?
Those would be important things to know.
Okay. And then the chapter talked a lot about Down syndrome, and that was pretty much the only like abnormality it talked about, so I didn't know
Yeah.
if there was any more you were expecting us to know.
Seems like in the past there's been a question about Tay-Sachs and knowing that it was a Jewish thing.
Okay.
It's hyphenated.
Is it in the book?
TAY-SACHS.
Hyphen SH, is that what you said?
SACHS.
CHS, okay.
Is that the one that's Ashkenazi Jews?
It's
Or-
probably an Ashkenazi. Probably.
And what is the one where the Amish people can have 6 fingers? Klinefelter? No,
I don't think it was Klinefelter's.
no, there's,
I thought that was just polydactyly. I didn't know it was
Oh.
a part of a syndrome. I thought that was
No.
inbreeding is what it
well, that's because in the Anabaptist communities, they marry in their families so much. There's something that it's like a syndrome. I'll have to look it up.
Well, and that's important to know too, because a lot of the royalty, like with the hemophilia with the Old English royalty, it was because they could only marry each other. And so if you have recessive genes bouncing around, but you just keep intermarrying, you're creating a big problem here with, again, Tay-Sachs with Ashkenazi Jews. Okay. That is not gonna have much on the exam about
Okay.
that, so
I
don't.
shouldn't
What about
panic
like
about
the,
all that.
what about like the
Yeah.
dominant recessive?
Autosomal dominant or autosomal
that-
recessive, yeah.
I like know the gist of it, but I just,
I just like got out of the book that dominant
Doesn't
is
think
the
the book was-
stronger, and then recessive is the weaker. So you can only have one dominant gene and it can show, but you have to have 2 recessive genes for the trait to show. I think that was like the
whole
main thing I
chapter
got out of
was-
it. That was a lot.
yeah,
That was a
that's
lot.
why I'm like, I thought I understood before, now I don't. So.
Do we need to know like all the common tests during pregnancy, like, for like syphilis, HIV, all that stuff?
No, I think I took those out. Just because the volume of stuff we're going over. Other questions?
Do you expect us to know like every culture's, what's it called, like
Every
evil
little
eye,
thing?
or like if they don't like touch, or if they don't want us to praise their baby? Do you want us
Some
to
of
know
the-
every culture's, or?
That's impossible.
That's why, because the book was going over a lot of them.
Yeah.
I was like,
You're gonna wanna know, like, some don't want eye contact. Some cannot have a male care provider. The evil eye, there was another one you mentioned that is good to know about.
the touch.
No, not so much. Oh, paying attention to the baby, well, that's part of the evil eye, I
Yeah.
guess, but, you certainly cannot know everything about every culture. But those are kind of big ones.
Okay.
Especially if you work at Mary Greeley, because ISU's right there, we have a lot of different cultures. And like, is it the Chinese or the Japanese? Yes, to everything, and that doesn't mean they understand. It just means that they're acknowledging that they heard you. And that is confusing to us, because we assume they understand them, and they might not. Other questions?
Is there like infant feeding questions?
As relates to mom, when it comes to the baby's concerns about feeding, we'll cover that in the next unit. So like the mastitis, well, that has to do with feeding the baby, but it's the mom side of it. And oxytocin, well, that's the breastfeeding, but mom's side of it.
What about like the drugs, like the Pitocin and?
That's a lot, I thought we would go over next unit.
Okay.
Yeah.
I have prolonged rupture written down.
Okay, what does that mean?
We'd have to do frequent vaginal checks
No,
or something, or
keep your fingers out of there.
keep your fingers out, okay? Because it can introduce bacteria?
Yes. Same with any vaginal bleeding, the previa, the placenta, anytime there's any vaginal bleeding, keep your fingers out of there.
So that could mean like they ruptured but didn't come into the hospital like 3 days or 4 days ago. And that's
Prolonged is more than 24 hours, I think.
Mhm.
And bleeding is, anytime they're having any bleeding. For the bleeding, it's because you're gonna make the bleeding worse. She's bleeding, don't make it worse. We do a lot of times, we'll do several ultrasounds when they have a previa, placenta previa. Now, why are we doing that?
To see if it's moved at all?
Because sometimes it can pull it up away from it. And we wanna see where it's at, because again, I can't deliver through it.
You said you do the intravaginal ultrasound for that one? Is that the only, no, you do the regular. I'm confused.
I guess it depends on how low it is, but usually we'll
Okay.
just do a regular to see if we can get, yeah. Now, if I can go, we do a lot of intravaginal for early pregnancies. Early pregnancies. What else? Good questions. Let me see test taking concepts. Remember, sometimes, like I said earlier, they're giving you all this history when the bottom line is they're asking about C-section, postpartum, whatever complication. They're just asking about a surgical complication. Don't overcomplicate it sometimes with all this OB stuff. It's still a surgery. Okay. Signs of a hemorrhage are the same if you got a GI hemorrhage. What other test taking things? Prioritization. You guys have had that, you've been hit over the head with that a lot, but there's some prioritization.
Can you give an example of that, like the weeks pregnancy, but they're all like in labor? Like who would you go to first, that type of thing?
So I have to have some examples. I
Sorry,
would
yeah.
go to somebody that is, like, okay, I've had 5 babies. If I were to show up, gravida 5, and my membranes are ruptured, and when I was in the office last week, I was dilated at 4, I'd probably go see me pretty quick. If a primip comes in and she's bleeding, well, I'd probably see her before I saw me. A primip comes in, thinks her membranes have ruptured, but she's not really contracting much. She's on the low end of my priority. Bleeding is usually high. Yeah.
Bleeding and multiples or whatever, multipairs.
Because my baby's just gonna fall right out. A primip, I got a little time, but my baby's coming.
Okay.
Alright.
That kind of happened because the day that I was in clinical, that I finally saw vaginal delivery, they sent me to the next room because the lady was like 8 or 9 or something. She was like having her baby, but then when I was in there, my other lady ended up like having her baby before this lady even had hers. I'm like, darn it, I could have seen 2.
Yeah.
My other patient today gave birth in triage yesterday.
Oh no.
She came out of her car and then like right there and the head was already out.
Oh my gosh.
She's fine, baby's
That's
fine.
scary
Did she
though.
like hold it into walking?
Well, I asked her, I don't know, I asked her like how it went. She's like, well, it was a lot faster than my first one. I was like, yeah.
I was about to ask, was it her first or more than that?
If they come in a wheelchair on one butt cheek, look for a head, or crowning or something. That's a good indication. What else?
I think it's so weird that the multi-pairs are more painful than I think that's so strange to me. That doesn't seem right.
Because my uterus has been stretched out more and more times than yours has. So I have to have a lot more going into getting it back together. Plus my oxytocin, I probably am responding a little quicker because I've been there, done that. But I've stretched so many times that I'm also maybe higher risk for hemorrhage though, because I've stretched so many times. What else?
need to know like Braxton Hicks versus regular control.
No, I don't think so. That is a really good question to know. Now,
I saw a TikTok and it's like in my head now.
tell us, what was it?
I'll show you.
Is it the balloon? That one was good.
About Braxton Hicks.
A balloon?
Why didn't
Braxton
you watch
Hicks?
that? Yeah. Actually,
It was literally Lindsay was talking about it, and then I get on TikTok 10 minutes after, and it was the first video that came up.
It's like they're listening to
Our
us.
phones listen to us, they definitely will. Why am I not being funny this week?
Me too.
I'm so
I'm
hungry
literally-
for no reason.
Got to tell it to go.
Why am I
You can't go to waste.
versus true contractions. What's going on in your
But
uterus?
before you
Meet
guys
your
even ask for it,
uterus.
I've been
More
eyeing it the
importantly,
whole time. I'm
meet
like,
your
can
uterus
someone
lawyers
please
as well
open
in
up?
all
I was waiting for TikTok.